At this time, I'd like to turn it over to my colleague from the House, Congressman Nunes.
Thank you, Paul. I want to talk a little bit about how do we achieve this access, and I want to make 3 important points. The first point is, if you like your health care, nothing changes for you. You keep what you have. The second point is that we create state exchanges. So every state will have the ability to create an exchange where there will be an 800 number and there will be an internet accessible tool where you will have basic plans put on the state exchange. Now, you still would have the ability to go out into the open market, but at the same time you would have the ability to go on the exchange. And this gets at the point of how are you going to make people aware, because only 10% of the people in this country today actually go out and choose their own health care. Everyone else has health care that's either provided by their jobs, or they're on Medicare or Medicaid or some other type of government program. And so what we are doing is we are creating easy accessibility for all Americans to access this as this plan would be enacted. And let me make the third point, and I want to use a real-life example of how Americans would be treated under this plan. If you are a single mother of 3 and you're making $16,000 a year, today essentially you're on Medicaid and you go to the county clinic. What this plan does is we do away with that. We do away with that. This is very powerful. You will have $11,000 to go out and choose your own plan, just like I choose, just like anyone in this audience can choose. You have $11,000 to do that. So for the first time in this country, we will empower the American people, the single mother of 3 out there, to have access to her own doctor and her own health care coverage. And I think that's a powerful statement. All the other plans that you're going to see out here today, or they're going to be introduced in the next month, will not do that. They're going to add more fuel to the fire. They're going to put more people in the county health clinics. That's not what we want to do. And that's what we want to change, and that's why I think this is a very powerful and innovative solution to our country's health care problems. And with that, one of the authorities on health care. Oh, okay. Another authority other than Senator Coburn, but Senator Alexander, thank you for coming.
Thank you very much. I'm here today as chairman of the Senate Republican Conference to congratulate Senator Burr, Senator Coburn, and Congressman Ryan and Nunes on their vision for creating a health care plan that's worthy of the party of Abraham Lincoln. Abraham Lincoln used a limited government to confer opportunity. In his time, that meant a Homestead Act. That meant a legislation to create the land-grant colleges of America. It meant a transcontinental railroad. In our time, it means giving Americans, number one, the ability to afford their health insurance, every single American. It also means a guarantee that the patient, the American, makes the decision, not Washington, D.C. That means that each of us would have a right to choose our own doctor. Each of us would have a right not to wait for tests for weeks. And each of us would have a right in the end with our doctor to make decisions about our own treatment. This is an imaginative proposal. It deserves serious consideration. It is patient-centered, not Washington-centered. In the spirit of Lincoln, it confers opportunity. It is not a command and control Washington decision. It has attracted my support and co-sponsorship. I predict it will attract the support of many Republican senators, and I believe it is powerful enough that many of its ideas will attract the support of Democratic senators as well. So I congratulate the sponsors for their hard work.
Thank you. I'm Tom Coburn from Oklahoma. I am a practicing physician, still get to do that. And I would remind you that health care is about people, not programs. And if you look at where we are today in terms of the programs that we have for health care, the ones that are failing the most are the ones that are run by the government, whether it's VA care or Indian health care or Medicaid and certain aspects of Medicare. So the focus has to be on individuals, and it has to be on how we enhance individuals to make great choices for themselves and give them the freedom to do that. We believe we've done that. We looked at what the private sector was doing. If you go look at Safeway and the self-insured, how did they incentivize prevention and health care and chronic disease management? How did they have only a 0.5% increase over the last 4 years in their health care? versus others that have not incentivized those things. So the potential of taking good ideas that are out there and making those available through access to everybody in this country in a way that's fair, that keeps the decision between the individual and their doctor, no one standing in between that, because it is about people. Number two is we looked at and we considered what happened when we set up a system for Medicare Part D where we had real competition among insurance products and real innovation in insurance products. And what happened is the cost came in 40% below what we thought they would be. Even this year, they're 40% below what we thought they would be. So the fact is we know real competition with individuals will drive that. And we believe that we have the start and the framework for an answer. It is bold. We admit that. But we know that health care isn't what it should be in this country. Even if you are insured, it isn't what it should be. And so the goal is to make sure everybody has an accessible coverage with their own choice reserved on a timely basis, because delaying your time for access is the same thing as not treating it. You have time to buy a new car. You don't have time to treat a heart attack. You don't have time to treat that cancer. It needs to be available and accessible on a timely basis. So my hope is that we will create enough inquiry that some of these ideas will be utilized, and perhaps this will be utilized. There's a lot of details of this plan. It has to be. This is a complex area for our country, but we recognize that there has to be some change. We would be happy to take your question. Yes, sir.
Stephen Lane, Oklahoma. I'm just wondering, how and when are you going to try to approach Democrats with this plan? What are you scheduling? How are you going to bring this to them to get some sort of response?
Well, we've already started with some of the former governors in terms of letting them see the Medicaid plan, in terms of rolling people over. If you think about the $1.3 trillion that this plan saves just for $960 billion for the states over the next 10 years, where states are in such a difficult deal, it's an interesting prospect to say that we can cover all these people and save money and do it at a lower cost than what we're spending today, plus give them much better care. So we have already approached several of the members in the Democratic Party in the Senate in terms of that have previous experience as governors to let them look at this aspect of the plan, and we will be working hard to try to get everyone to consider it. We don't know who's going to agree with us or not, but what everybody agrees in is we need to make major changes in health care in this country. And the track record of the government doing it isn't very well. We don't have a good track record. And so maybe we ought to use what's working well out there and make sure everybody has access to it. And that's what we're trying to do.
Republican moderates in the House tried to roll out their own health care reform plan this morning. They are opposed to ending the tax exclusion on employer-sponsored health benefits. Do you see your plan being complementary with theirs at all, or are you at loggerheads?
I can't answer that. Maybe some of the guys from the House can answer that.
Sure, we're going to have many ideas coming from Republicans. Republicans are going to be putting out a number of different ideas on how best to solve this problem, and you're going to see those rollouts occur. I've talked with Mark Kirk, who's the primary author of that plan, and there is so much we agree on how to move forward with health insurance reform. We believe that the tax exclusion penalizes and discriminates against people who don't get health care from their job. And we also think we ought to reflect the 21st century workforce, which is people change their jobs. So we're simply saying let's transfer that tax benefit from being attached to your job to being attached to each worker. At the end of the day, people will get a net tax cut out of that. At the end of the day, people will have more freedom of choice, and if they like what they've got, they can apply that tax benefit to what they already have and keep it.
And let me just add one thing. We might have sort of gone over this too quickly. This plan is budget neutral. This plan does not require an additional dime in taxpayer investment to cover 100% of the American people. It's absolutely essential on our part that we create a health care reform model that doesn't rely on more money going into the system. We've got to make sure that the architecture of what we design is sustainable for not just the increase in the population, but the ebb and flow that we're going to find through breakthroughs in technology and healthcare in the future.